What's going on, everyone? Welcome to the Sunday Pandemic Update for Sunday, April 23rd, 2023. If you are seeing this video, you made it through another weekend in a pandemic. Hopefully you've done so safely. Hopefully you did not test positive. Not a lot of data to report on today, but of course we can report on India today because India updates on the weekends. The United States does not. Hello, CDC. We need updates 7 days a week. The pandemic has not ended. Alrighty, let's start off with this, and then we have a whole slew of news stories that I want to share with you today. Some that I think are very important, a couple that are rather sad as well. 10,112 new COVID cases in India, 17% lower than yesterday. The daily positivity rate was recorded at 7.03%, and the weekly positivity rate was 5.43%. Then we come down here to fatalities. They added another 29 fatalities, so their deaths, the overall count, it's still going up. It's not like this new wave is not causing deaths. It is. Alright, music fans, or anyone who's a fan of BTS. J-Hope has tested positive for COVID. Moving on to this, in the cycling world, Omen and Van der Sande, non-starters at Liège with COVID-19. So they have both tested positive. They will not be starting in a cycling competition. Alright, moving on to this. This brings me to something that I think we're going to do this week, which is an update to staffing shortages. Why? Read the headline. Long COVID symptoms keeping many Americans from returning to work. Yeah, there's several different reasons. The biggest one is long COVID. Another reason for the staffing shortage is during the start of the pandemic, a lot of the baby boomers that were getting ready to retire did just that. They retired, and that was the end for them. They don't work anymore. So therefore, their positions also did not get replaced because, number one, people have long COVID. Number two, there's just a shortage overall. And the biggest reasons of it all is long COVID. And we'll get to that this week. We're going to do another edition of staffing shortages and all the various excuses that come with it. Because there are many different excuses being blamed for why there are staffing shortages. We know the main reason. It's the pandemic. Alright, moving on to our next story. This is over in the UK. Rise in school absences since COVID, driven by anxiety and lack of support, say English councils. Hello. Yet again, we just talked about this a second ago. We'll talk about it again. Long COVID. Kids get long COVID too. And if they get long COVID, they're sick. They're not able to learn properly. They have various different organ damage. And it may prevent them from going to school at times. That's a big reason for absences, too. Alright, speaking of schools, we move on to this. I found this yesterday. 130 Hyde Elementary School students and staff absent Thursday amid suspected outbreak. This is in the Houston metro area, I believe. It says League City, Texas. A League City Elementary School campus has been forced to enter the weekend a day earlier in the midst of what district officials call a gastrointestinal illness outbreak. Now, it could be that, or it could be coronavirus as well. We don't know, but it definitely sounds like there's something going on there. And 130 students, that's out of the school's population, which is 671. Here's what the symptoms have been. Clear Creek ISD urged any students who have symptoms like vomiting, diarrhea, or stomach pain to stay home until they are symptom-free for 24 hours. And if you notice here, there's no mention here of mask wearing because, why would you wear a mask for an illness? It may help, but they're not suggesting to do that. Alright, we come on to this, some very sad news. Anyone who grew up in the 90s, or maybe you still watch it today, he's been on for a long time. Eric Braeden, he plays Victor Newman on The Young and the Restless. I watched it in the 90s, 2000s, even the 2000s and 10s. There wasn't a day I wouldn't, or a weekday that I wouldn't go to Grandma's house, and The Young and the Restless would be on at 12:30. And I continued to watch it until so long I stopped watching it. Anywho, yes, his star reveals he has a cancer diagnosis. I actually watched his video. It talks about there being a video here. And I saw the video on Facebook Live. It was about close to 10 minutes long. It's really sad. He was undergoing, I believe it was a hip replacement. Then he started having a urination problem, and then he went on to get that resolved. And as they were trying to resolve it, they found, wait a second here, you have cancer here. So he was really emotional, actually, at the end of his video. So I'm glad he's getting it treated. He's currently undergoing immune therapy. Hopefully he beats it. He's a really tough man. As you all know, if you've ever watched the show or know about his personal life, he's very athletic in his personal life. He is going to do everything in his power to try and beat this and get through it. Moving on to this. Ray Romano. Remember we talked about this the other day? Well, here's the latest. Ray Romano had a stent put in his heart after having 90% blockage in his main artery. So now we are told that he had a stent put in. And there's a little quote here. I know in my head I don't feel that old. In my body, I'm getting a couple of notices that I am that old, the actor explained while discussing his health. So hopefully Ray Romano is undergoing a speedy recovery. Hopefully he gets better soon. Moving on to this. Alright, this is some more bad news. You know that community transmission map? You know, it updates every Thursday. I show it 7 days a week here on the channel. Pretty soon we may not be showing it anymore. This was something I was informed of that's on Twitter. And this was from Myra Batchelor. She tweeted out that hearing CDC is going to end their tracking of the COVID-19 community transmission when the public emergency ends, which is what hospitals and medical settings are supposed to make mask decisions based on. Yet another reason we need to keep masking in healthcare. Yeah, in case you haven't heard, I think what I'm starting to figure out here is, though Congress and Senate passed that silly bill which ended the emergency early, CDC is still doing some things. Unfortunately, it's now April 23rd. I think on May 11th, some more reporting is going to end from the CDC. It's just a sad reality of the times. And that means the COVID transmission map will no longer be available. Let's take a look at this. There's actually a little post here, or graphic screenshot from the CDC. Percent positivity metric will likely no longer be available. COVID-19 transmission levels used primarily for healthcare settings would no longer be calculated as they involve case and test positivity data. CDC is determining how to address healthcare guidance without use of transmission level. So you're determining how to address an issue without having any available data. That's just utterly ridiculous. And that's where we're coming to. Alright, this day in COVID history, pandemic history, whatever you want to call it. April 23rd, 2020. Using funds from the Coronavirus Aid, Relief, and Economic Security CARES Act, CDC announces $631 million to fund and expand the existing epidemiology and laboratory capacity for prevention and control of emerging infectious diseases, ELC, allowing state health departments to expand their capacity for the testing, contact tracing, and containment of COVID-19. And it looks like there is one more thing. April 23rd of 2021, ACIP and FDA recommend the continued use of Johnson & Johnson's COVID-19 vaccine for all people ages 18 years and older in the U.S., following a thorough safety review after the use of the vaccine was paused when 6 cases of rare and severe type of blood clots were reported. We've said some brief things about the Johnson & Johnson vaccine before. I'll say the same brief message I said last time. Whatever happens to the Johnson & Johnson vaccine, you hear nothing about it. It's not even advertised on TV or in the news. It's just pretty much fallen off the face of the earth. And that's all I will say about that. Moving on to wastewater, here's the national level. The West Coast is still rising. The East is generally flat to slightly dropping. That includes the Midwestern states as well. Taking a look at the national wastewater here, the map from the CDC. Hopefully we don't lose this on March 11th. I'm afraid we will, but we might not, because there's been new sites being added, although they're not updating frequently. New York State, we still have this issue with sites not reporting. New York City, there's still some. Let's just click on a couple in New York City. Here's one in Queens, 728,000 people. It is flat at this time. We'll do one more in New York City. Here's one. Let's see here. Let's do this one right here. Kings County, 758,000. And it's flat to slightly dropping. Maine, the levels have actually dropped. Low to near moderate. For the most part, low. So that's some good news. Great Lakes, we still do have a number of moderate to near moderate places. But even there, it is dropping. And then you come down here. And let's just take a look at this red one here. What is going on here in Yuma, Arizona? Small site, 18,039 population. But look at that. It is rising. Taking a look at the CDC transmission map, 671 counties are at high, 468 are at substantial, 1,393 are at moderate, 591 are in low. Taking a look at the latest variants, 73.6% are to XBB.1.5, XBB.1.16 is 9.6%, XBB.1.9.1 is 7.9%, XBB.1.9.2 is 2.9%, and XBB.1.5.1 is 2.2%. New Jersey did not update this weekend, can't really tell you about that. Nothing from Pennsylvania. There's Center County, Pennsylvania, still 6 hospitalizations there as of Friday. We'll get a new update out of them tomorrow. New York State does not update over the weekends anymore. 677 cases were reported Friday, 2% positivity, 1.5% 7-day average. The hospitalizations in New York State on Friday's update were 753, and 83 people were in the ICU. Taking a look at some international data here, and to make sure it's most up to date, let's give it a refresh. South Korea, cases up 18%. India, cases up 20%. Deaths still up 44%. Interesting to note that rise in India, starting to shrink. It's still there, but it has shrunk some. It's too early to say if they have peaked yet. Japan, cases up 15%. France, cases are now down 7%. Some of this could be because a lot of countries do not report over the weekend. France's deaths are up 59%. That's concerning. Russia, cases down 11%. Deaths down 2%. Australia, cases down 13%. Deaths down 21%. Brazil, down 53% on cases. Deaths down 49%. Italy, cases down 22%. Deaths up 4%. Vietnam, whoa, 378% increase in cases. 12,703 this week versus the previous 7 days of 2,655. And they are, I believe, entering the XBB.1.5 variant last I saw. They're just seeing their way for that. So that could be causing their increase. And mind you, they have not had a surge in quite some time. Germany, cases down 14%, deaths down 6%. Mexico, cases are up 6%, deaths are down 3%. Spain, cases continue to rise, up 19%, deaths up just 1%. And we'll end it today on Indonesia, where cases are up 18% and deaths are down 9%. Alrighty, that does it for today's pandemic update. I do quickly, though, just want to show you the flu levels, just real quickly here. You can see New York City is back to moderate levels. Washington, D.C. is back to moderate levels, as is New Mexico. California is low to near moderate. Puerto Rico is moderate. The rest of the country is low. So there are no more high states with flu in the United States. Alrighty, thanks for watching today's pandemic update. We'll have another one of these again tomorrow. And at some point this week, if not tomorrow, sometime this week, we will do another edition of staffing shortages. Alright, I'll see you all again next time. But until I see you again next time, hit the thumbs up button if you like this video. Hit the subscribe button down below if you want to see more content like this. And you have to test negative and stay safe till next time. I want to see you back here again next time. Okay? Have a great Sunday evening and have a fantastic week ahead.